You may have seen this headline lately, the New York Post writing about women performing at-home liposuction on themselves. Some of them using $95 kits they bought online to shed weight. This stirred up a lot of debate in our newsroom, and so we wanted to know more about this reportedly growing DIY lipo trend. So Dr. Tae Chong, he is the chief of the Division of Plastic and Reconstructive Surgery at Rush, joining us live to talk about this. Doctor, thank you. I had no idea this was a trend. I'm curious if you've heard about any DIY cases around here and what you think of them.
Luckily, we've not heard of any cases here or seen some of the complications that can occur from it. What I'm a little concerned about, actually, I'm a lot concerned about it because it's the power of social media is advancing these, and patients are being seen these amazing results of befores and afters, and they're tempted to try these things at home, and they can be fairly dangerous if not done well. A lot of these are unregulated products that we don't know anything about. And so people are injecting these into their soft tissue with some variable effect. And I don't think that they're delivering upon the promise. In fact, if you look at a lot of these stories and the photos in social media, you're seeing the patients before their massive weight loss with the GLP-1s, and then afterwards.
Okay.
And they're touting the afters as a result of the product and not necessarily the GLP-1s.
Interesting. I mean, I would have to think too, the danger seems fairly obvious, and people aren't necessarily medical professionals that are doing this at home to themselves. And do we even really know what's in some of these solutions? Is it regulated? So many questions.
No, there's only one product on the market that's regulated and approved by the FDA. The rest of them, it's variable components, variable concentrations, and some of them have proprietary things that they won't even tell you what they are. And the risks are, at every step there can be an error. So if you inject them too superficially, you can have skin loss and open wounds. If you inject them near a nerve, you can have temporary facial paralysis. And then a lot of patients are having, nodularity or thick fibrotic areas, especially around the face, which are not what they wanted, and you can always get infections. And whenever you're injecting anything around the face or the head and neck, you got to worry about airway issues. So there's a lot of risk that can occur with this.
No kidding. I'm wincing over here, doctor, as you're running through these possible.
It makes me wince too.
Yeah, right. I believe it. So if someone is considering liposuction or any other cosmetic surgery, what is the first one or few things they should do to avoid becoming one of these gone wrong stories?
Yeah, the one thing about these is they shouldn't be called do-it-yourself liposuction because they're not suctioning anything out. They go on the principle that it causes loss of the fat cells or dies, and then your body absorbs it. If you're really interested in liposuction or body contouring after weight loss, go seek out a board-certified plastic surgeon. Get a consultation. There's a lot of information out there, and that's good news because you can go to the American Society of Plastic Surgeons, the Aesthetic Society, or the American Board of Plastic Surgery and get consumer information, but also get links to providers that are safe practitioners of plastic surgery. We only have one body on this earth.
So true.
And so take the time to find somebody who's going to help you accomplish your goals, but get there safely.
The best advice we could ask for today. Dr. Tae Chong with Rush, thank you so much for your perspective and your time today.
Thanks very much.